Okay, so this will be the video talking about if your surgeon would like to utilize a chlorhexidine or a Hibiclense scrub for their prep of their area that's going to be utilized for their surgical incisions. So if they want the scrub, then you're going to need a scrub tray, which possibly could have the Hibiclense inside of it. If not, you might just get an empty scrub tray that doesn't have an agent in it, and then you'll have a large bottle of Hibiclense that looks similar to this. Then you'll have to add the agent to the scrub tray after it's been opened. So we open it just like a gown or an envelope wrapped item on a flat surface. You can use a Mayo stand or a prep stand. Open the flap away from you, then the two side flaps, then the flap that's towards you last. Now, if the items inside are positioned correctly, you may be able to pour the solution into the tray. If not, you may have to don your sterile gloves first and then move the items and then have somebody else pour the solution to you. But it looks like I have the ability to pour this solution, so I'm just gonna go ahead and pour some of that Hibiclense onto my scrub sponges there so that I can utilize that once I do my scrub. In some of the prep trays, you're going to have a pair of gloves. They're kind of a one size fits all, so some people use them, some people don't. You can choose to use them. If you are, you're gonna go ahead and pick them up and move them to another surface so that you can open glove, or you can open your own size of gloves on a separate surface, take them out of the package, and then don them utilizing the open gloving technique. Open them up, touching only the outside of the wrapper. Don't touch the sterile gloves on the inside. Make sure that you fold your wrapper edges back so they're not gonna fold back and contaminate your gloves. You grab only the inside of the cuff on the first glove that you're gonna put on. Go ahead to start to slide that on. Go ahead and pull the cuff back. If it rolls back, that's fine. Don't mess around with the sterile side of the glove. On the second one, make sure that you grab underneath the cuff so that your hand is going to be protected with the sterile portion of your glove. Start to slide your other hand in, making sure that the glove doesn't come back and contaminate on the sterile portion. And then again, continue to slide that on. Again, if it rolls back at the edge near your wrist, don't mess around with that so you don't end up contaminating your gloves. Up here, you're gonna have some towels inside. Some of the kits will come with 2 towels, some will come with 4. If you have 4, sometimes they'll take some extra towels and tuck them around the sides of the patient, especially if you're gonna be prepping all the way down to the patient's bedside, where you wanna make sure that you're not gonna contaminate yourself. So you might wanna take those and tuck them underneath the sides. If you're just gonna be prepping on the top surface of the abdomen and not worrying about going down to the sides, you may not necessarily need to tuck those, but if you wanna prevent that prep solution from pooling at the sides of your patient, you'll wanna make sure that you tuck those. Go ahead and move these if you're just gonna use them as dry towels to the back. So first thing on an abdomen that we want to prep is the umbilicus. So remember that Hibiclense only comes in a scrub. There's not going to be a paint like there is for betadine. Okay, so you want to just take your cotton tip applicators, dip them in the scrub, and then you're going to come over to the umbilicus and clean out the umbilicus. And then remember, these are dirty. That is considered a contaminated area. Most of the time we prep that last. But on the abdomen, we always prep it first because we don't want anything contaminated to run out over our prepped areas. So I want to make sure I don't put those back in the prep tray. Either throw them in a trash can or onto another separate surface. Okay, grab a couple of your scrub sponges. Go ahead and squeeze out the excess so that it's not going to run down the sides of your patient. And then we're going to start at our incision site and start to scrub that area in just kind of circular motions. And then start to work outwards towards the periphery, including whatever site is needed for wherever our planned incision area is going to be. Now, different surgeons are going to have different preferences as to how long the area needs to be scrubbed. Very commonly for Hibiclense, it's going to be 3 to 5 minutes. So depending on how long, you know, you have 3 sets of scrub sponges here. So if it was a 3-minute scrub, you'd make 1 set, you know, each set lasts approximately a minute. Get rid of those. Once you get out to the periphery, you don't take and put the sponges back inside the prep tray, you get rid of them, toss them in the trash or a separate area, come back, grab some more sponges, squeeze out the excess, and each time you come back, starting at the incision site, spending the most time in that area because that's the most sterile area, and then proceeding outwards towards the periphery. Remember, we want to scrub hard enough that we're going to be getting the microbes off, but if your patient had any preoperative skid markings, you want to make sure that you don't scrub those off. And then a third set. And squeeze out the excess. Go back to the incision site. And then go out to the periphery. Once your designated time has lapsed, then you're going to dry the area to get rid of the suds. So you want to make sure that you open up a towel, avoiding touching any of the contaminated areas. So make sure you don't let it drag on any portion of your wrapper that's hanging below a sterile level. And you open it up over the area that you've just prepped. Kind of push it down so it soaks up all of those suds, and make sure when you pull this towel off that you pull it back so it's not going to bring any of these contaminated areas back over the prepped area. So we're going to take and pull it off and then get rid of it. If you need to dry a second time, make sure again that you avoid any contamination. Open it up over the area, pat it down, and then get rid of it. And that's how we use